When to do semen analysis? That's the most common question asked by everyone. So when there is a unprotected intercourse between an Indian couple, a newly married couple for 1 year duration, and still if they don't conceive, there is no child, then there is a definite indication to do a semen analysis. What are all the parameters which we look in semen analysis? We look for the number of sperm cells in the semen analysis, we look for the motility of the sperm, and we look for the morphology of the sperm. So these three are the most important parameters we look in semen analysis. What the World Health Organization has said is, ideal sperm morphology level is only 4%. So if it is more than 4%, then the guy is said to be a good fertile guy. Hello everyone, I am Dr. Ganesh Prasad, consultant urologist and andrologist, and I am here to discuss few of your queries about semen analysis. Now there will be a question running in the back of your mind, how to do a semen analysis when it is indicated. Now, when to do semen analysis? That's the most common question asked by everyone. So when there is a unprotected intercourse between an Indian couple, a newly married couple for 1 year duration, and still if they don't conceive, there is no child, then there is a definite indication to do a semen analysis. So here an important point I would like to stress is, instead of taking the wife to unnecessary investigations, putting her to investigations, we have one important test which is a very simple test in men, which is semen analysis, which can give an idea what is happening with the couple. Because 50% of the time it's a male infertility factor, and this simple test, a simple semen analysis, give an answer before proceeding on to doing a workup for the women. Due to the taboo and due to the social scenarios, many a time the workup actually starts with the women, but that is unfair. So a very easy test to do and a very simple test which will give an idea what is happening with the man's side is doing a simple semen test or semen analysis. Now, where to do the semen analysis? Next common question is where to do, whether we have to do it in a laboratory or it has to be done in a different way. So majority of the time semen analysis is done in a laboratory, in an isolated room where the male masturbates, takes semen for a test and gives for test. But ideally speaking, if the semen analysis is done at home in his own surroundings, then the reports are really good. The reports are really good and the reports are really reliable when compared to the semen analysis which is done at lab. So now the next question arises, suppose I am going to do a semen analysis at my home, at my own way. It can be done either during an intercourse, the male can stop and take the semen for analysis, or it can be done following masturbation, whatever is possible at the home. But how long the lab should be there and how long should I carry the semen with me, and when the test is said to be ideal. So the lab should be at a very short distance, maybe 10 to 15 minutes distance from the house of the particular person, and it should be a good lab which does a very good analysis. If CASA is available, computer based analysis is available, then it's ideal to have a CASA analysis. So that is the important point. The liquefaction of semen takes around 15 to 30 minutes. So if the time is going to get prolonged after collection, if the person is going to carry for longer duration, then there is going to be a misguiding with the results. So it's ideal to be done at a lab which is 15 minutes distance from the patient's home. Okay, so now how to collect? So ideal collection should take some amount of time in doing a semen analysis instead of doing it in a mechanical way, either having a proper coitus as a husband and wife and taking semen analysis after a coitus, or having a proper masturbation with ideal settings will give a correct semen analysis than the one which happens at a laboratory, which I have discussed already. Now, what are all the parameters which we look in semen analysis? We look for the number of sperm cells in the semen analysis, we look for the motility of the sperm, and we look for the morphology of the sperm. So these three are the most important parameters we look in semen analysis. So if the numbers are less, we call it as oligospermia. If the motility is less, then we use asthenospermia, the word asthenospermia. And if the morphology is problematic, then we use the word teratospermia. See, all these are very difficult jargons for new people, but it's very easy and I'll make it very simple. So what the World Health Organization says is, in a collected sample, if the sperm count is less than 15 million, then it is called as oligospermia. As simple as that. I will explain everything in detail in the upcoming video. Actinospermia means the motility is very slow. Ideally, 30 to 40% of sperm should be motile and moving fast in the microscope. If the amount is going to be less than 30%, then it means that it is actinospermia. And finally, you have a different term called as teratospermia. Terato means death. So that means that sperms are of different morphology, or you see dead sperms in the specimen. Okay. So I will tell you an interesting fact here. Ideally, in a normal male, world over, wherever it may be, if you take 100 millions of sperm, only 4 millions are morphologically correct. Okay, usually it's 4 to 10 million. So what the World Health Organization has said is, ideal sperm morphology level is only 4%. So if it is more than 4%, then the guy is said to be a good fertile guy. So that is the news to you, and that's a very important fact here. So you have to find a lab where they look for the morphology, which is the most important thing among all these things. The morphology should be looked in a good lab actually. So we'll stop here and we'll continue in the upcoming video about all these parameters individually. See you, bye.